Now it's Purva
Thank you,
Srivastava
sir.
for her presentation.
Good morning, respected
Dr. Pratik, please come here.
dignitaries on the dais. I, Dr. Purva Srivastava, will be delivering this brief theoretical talk on the topic of ocular trauma from a resident's and a trainee doctor's point of view. So, ocular trauma is something that we very commonly see as a medical student, as a postgraduate student, or as a fellow also. So, whenever a trauma case comes to us, we are asked by our mentors or consultants to first take a good history and also ensure the systemic stability and then classify the injury that is there in front of us. So, we have very specific terms given to us by the Birmingham Eye Trauma Terminology System, in which we classify the injuries as closed globe and open globe. Closed globe is further classified as contusions or lamellar lacerations. Open globe injuries can be divided as rupture or lacerations, and lacerations are further classified as penetrating, perforating injuries, or the ones with intraocular foreign body. The various mechanisms, we are already aware of them, could be thermal, chemical, or mechanical. So this is just a very this is a flow chart depending on how we can take the history, and upon the slit lamp examination you can conclude that what kind of injury we are actually going to deal with. Now we are going to move to the ocular trauma score, so that we can have a better idea of what we are dealing with and how we can explain it to the patient that what we are actually expecting from the surgery also. So the points are given as per the presenting vision to us, and also the associated findings that we are getting in the patient, and then we make a sum total of the points, and depending on that it's a kind of a prognostic score that we have. So then as residents we are supposed to move to the counseling part, which is very important before taking up surgery or any kind of treatment that we plan to do. And like ma'am said, that it's important to ensure the systemic stability of the patient. So particularly in a setup like a medical college, we need to take help of the neurosurgeons or ENT department or anesthetist also, so that before taking the patient in the OT or in our department, we should ensure that the patient must be healthy and alive. So moving on to the examination part, as a resident we are supposed to carry out the visual acuity first, then moving from front to the back we are supposed to see the pupil, IOP, the motility, full external inspection of the lids, adnexa. So what are the findings that we usually see? We can just come across something simple looking like a subconjunctival hemorrhage or a chemosis, to more complex forms like a conjunctival tear or a dislodged foreign body, like we have already seen in other presentations. What about the corneal injuries then? There could be a foreign body enlarged in the areas of Madhya Pradesh. We very commonly have the iron foreign bodies. So depending on the kind of injury that we are presented with, we are supposed to deal with it promptly and also explain to the patient that what we plan to do. These are some of the pictures of the cases of corneal tear repairs that were done at my center. So we repair the corneal tears as soon as possible, that is within 24 to 48 hours of presentation, and then suture removal is done subsequently within 6 to 8 weeks in children or 2 to 6 months in adults. So since due to the lack of time, I'll just be moving through the slides. We are aware of the chemical injuries as they're very commonly seen in my area also. So this was just an image of a picture at our center which had come with a corneal
Can
tear.
you conclude?
Yes, sir.
Yeah.
Okay.
Last slide, please.
Yeah.
Last slide.
So the just of the briefly, sir, of the cases is just about the proper examination and how we are supposed to deal with the patient expectations also as a resident.
Okay.
It
Thank
was
you.
supposed to be only 3 minutes presentation.
Yeah, yeah.
Anyway.
Yeah.
Yeah.
Yeah. Thank